Good morning and welcome to UBLUR-TV. I'm your host, Brad Harmon, and today my guest is Dr. Trey Riggert with Columbia Pain Management in Hood River, Oregon. Dr. Riggert, thank you for joining us on the program this morning.
Pleasure to be here, Brad. Thanks.
As always, it's a privilege having you on the broadcast. Now, Dr. Riggert, I've been reading a little bit about some big changes that are coming up with Vicodin. Can you tell us a little bit about what the changes are and how that's going to affect people that are suffering with chronic pain?
Brad, great question. This just came out about 14 days ago. The DEA has been talking about making Vicodin a Schedule II opiate. That means it's going to be in the same category as fentanyl and OxyContin and methadone. Vicodin, Norco, the active ingredient is hydrocodone. It's the most prescribed opiate in America, and it turns out that America actually consumes better than 95% of the world's hydrocodone. If you think about that for a minute, we're 200 some odd, maybe 300 million people out of 6 or 7 billion, and we consume better than 90% of the world's supply of this medicine. So there's recognition that hydrocodone is abusable and in fact is involved in a lot of the overdose deaths in America. Not the primary cause typically, but usually it's in the person. The other issue is recognition of Tylenol overdose. We're seeing quite a few folks with liver issues from actually eating too many Vicodin because there's Tylenol in Vicodin. So they reduced the amount of Tylenol in Vicodin about a year ago, and then this year they're regulating it fairly heavily. So what does that mean for patients? It means that they won't be able to get refills on this medicine after October 6th. So if you're holding a script that has refills that last after that, my understanding from my pharmacist friends is that won't be honored. The medicine will no longer be able to be called in. So you'll probably have to see your physician on a regular basis to get this medication. And then, of course, there may be some doctors that are no longer willing to prescribe Vicodin long-term or short-term because of the recognition of increased risk.
Well, this is big news for people that have been using Vicodin to manage their pain. Thank you for bringing this up. So summing it up, what would you say the biggest effect of this change is going to be for chronic pain patients?
In the immediate term, people will probably lose the refills on their scripts and their doctor will not be able to call it in. So if you're taking Vicodin, you need to contact your pharmacist or your provider to make plans for this.
That sounds good. Well, thank you very much for bringing that news to us, and we'll probably discuss it some more in some future broadcasts.
Thanks, Brad.
Thank you, Dr. Riggert, and thank you for joining us on UBLUR-TV. We hope that we'll see you again soon on another broadcast.